Hey, welcome to The Explainer. Today, we're diving into public health policy. Now, you can think of it as this invisible architecture that's all around us, shaping our health and our safety every single day. Most of the time, we don't even see it, but its impact, it's absolutely everywhere. So let's get into it.
Just think about your day so far. Did you happen to buckle your seatbelt on the way to work or school? Yep, that's policy. Ever seen the calorie counts on a menu and maybe changed your order? That's policy too. Or what about working in a smoke-free building? You guessed it, policy. See, these aren't just random suggestions. They are the result of very deliberate decisions, all designed to kind of nudge us toward healthier lives. And today, we're going to break down exactly how those decisions get made.
So here's our roadmap for this explainer. You can pretty much think of these as the key sections for any great essay on the topic. We'll start with the absolute basics. What even is public health policy? Then we'll look at the perfect textbook way to create it before we get into the messy reality of why that so often goes wrong. After that, we'll talk about the ultimate goal, a big idea called health in all policies, and we'll finish up by figuring out how we even know if any of this stuff is actually working.
Okay, let's jump into Section 1. Before we can get into the nitty-gritty of how policy is made or why it fails, we've got to build a solid foundation. What are we really talking about when we use the word policy? This definition from Thomas Dye is absolutely critical. If you're studying for an exam, you have to know this one. And pay close attention to that last part, or not to do. That's the key. See, policy isn't just about passing new laws. When a government chooses not to act, like say, not to regulate sugary drinks, or not to fund a certain health program, that inaction is also a policy decision. It's a deliberate choice, and believe me, it has massive real-world consequences. And these decisions, they basically come in two main flavors. On the one hand, you've got your hard policies. These are the rules that have real teeth, things like laws, fines, and taxes. Think about motorcycle helmet laws or taxes on tobacco. If you don't comply, there's a penalty. But on the other hand, you have soft policies, which are all about encouragement. This is stuff like government advice on healthy eating, or maybe a tax credit to help you buy an electric car. They're nudging you in the right direction, but they're not forcing you. So, okay, if that's what policy is, how is it supposed to be made? Well, in a perfect world, there's actually a really clean, logical blueprint for this whole thing. It's called the policy cycle. And this image right here shows that ideal scenario perfectly. The policy cycle is always shown as this neat, circular roadmap. It's like a beautiful architectural plan for building a solid piece of policy. It's the textbook model that's supposed to guide you step by step from identifying a problem to creating a rational solution. Let's quickly walk through the stages you'd want to know. It starts with agenda setting. That's where we all agree something is a problem. Then comes formulation, where experts brainstorm solutions. Adoption is the official part, when a solution is chosen and passed into law. Next up, and this is a big one, is implementation, actually putting the policy to work in the real world. After a while, you get to evaluation. Did it work? And finally, support or maintenance, which is all about making tweaks. It all seems so logical, right? But if it's that simple, why is making policy almost always a huge, messy fight?
Well, that question brings us right to the messy reality of it all. This is the part where that clean, beautiful blueprint crashes headfirst into the real world, and things start to get complicated.
Now, here is a classic question, and one you might even see on an exam. Where do most policies actually fall apart? Is it in the design phase, the formulation, or is it when you try to put it into practice, the implementation? Well, the evidence is pretty overwhelming on this one. It's almost always implementation.
A policy can look absolutely perfect on paper. Take something like a smoking ban. The goal is clear, the rule is simple. But actually getting it to work in every single bar, every restaurant, every public space, well, that's when you run into a huge wall of real-world complexity. And here are just a handful of the reasons why that happens. Maybe there's weak enforcement, or the penalties just aren't strong enough. Maybe the policy clashes with deeply ingrained cultural habits. You could have business owners pushing back hard, or maybe there just isn't enough money or staff to make it work. And of course, a new government can get elected and just decide to scrap the whole thing. Any one of these can make a perfectly designed policy completely fail on the ground.
And this gets us to a really critical point, probably the most important takeaway for understanding policy. It is not just a technical process, it's a political one. You really have to think of it like a battleground, a constant tug of war. On one side, you've got your evidence and your experts with their neat blueprint. But on the other side, you have all these different groups or coalitions, each with their own deeply held beliefs and values, all fighting to win. It's a contest of ideas,
not just a simple search for the most logical answer.
So if policymaking is this complex, messy battleground, what are we even fighting for? What's the end game here? Well, in public health, the big, ambitious vision is a concept called health in all policies. And the whole idea is to get us to stop thinking about health as something that just happens inside a hospital or a doctor's office.
Because really, when we stop and ask what truly makes a population healthy, the answer isn't just about more doctors and nurses. The vast majority of what shapes our health actually happens far away from the clinic walls.
Now, this data is just fundamental. If you're trying to explain public health, this is a killer point to make. Just look at this breakdown. Only 10% of our health outcomes are directly linked to the healthcare we get. A staggering 70% is determined by socioeconomic factors, things like your income, your education, and the physical environment you live in. Our personal behaviors make up the last bit. This chart is the reason why public health have to be about so much more than just healthcare.
So what does this health in all policies idea actually look like? Well, it means the Department of Transportation is thinking about health when it passes helmet laws. It means the Treasury or Finance Ministry is thinking about health when it puts a tax on sugary drinks. It means agriculture, education, local councils. Every single part of government has a role to play in creating a world where the healthy choice is also the easy choice.
Which brings us to our final crucial section. With all this effort, all this battling, how do we actually know if we're making a difference? That, my friends, is where evaluation comes in.
And this graph, this is such a powerful example of what good evaluation looks like. It shows the steady, incredible rise in life expectancy in Malaysia over 50 years. That didn't happen by accident. This right here is the measurable, real-world result of decades of focused, deliberate public health policy.
And we can get specific. One of the key policies behind that graph was the National Maternal and Child Health Program. They made a plan to set up clinics to reach people even in remote rural villages. This single strategy provided things like home visits for new mothers, growth monitoring for babies, and family planning resources. It's a crystal clear line from a policy decision straight to a tangible, life-saving outcome. That is what success looks like. So we'll end with this big question for you to think about. On the one hand, we have the blueprint, that ideal, logical policy cycle that's based on solid evidence. But we live and work in the battleground, a messy world of competing beliefs and political realities. The single biggest challenge in public health policy, and really the question that will define the future of our collective well-being, is how do we bridge that gap? How do we make sure the powerful evidence from the blueprint can actually survive the fight on the battleground?